Today I will be teaching you about pharmacology, and this is regarding pharmacology made simple for nursing students. The main purpose why I started this is, having been a teacher for the nursing students for more than 5 years, I felt that pharmacology was one of the subjects which the students found difficult, and now with the revised syllabus having pharmacology, pathology and genetics, they find it difficult to study this subject and also to make time to combine all these three subjects and study. So this is the main purpose why I am starting this. So today we will be looking at the introduction part. Introduction and sources of drugs. In this we will look at the historical aspects. Pharmacology is the science that deals with the study of drugs and their interactions with the living system. India's earliest pharmacological writings are from the Vedas. An ancient Indian, Charaka, and then Sushruta and Bhagavata described many herbal preparations included in the Ayurveda. Indians practiced vaccination as early as 550 BC. So here we can see the images of Charaka, Sushruta and Bhagavata. Various other traditional systems of medicines were practiced in different parts of the world, like homeopathy, Unani, Siddha and allopathy. The basic reason for the failure of many systems is that man's concept about diseases were incorrect and baseless in those days. Francois Magendie and Claude Bernard popularized the use of animal experiments to understand the effects of drugs. So here we can see the images of Francois Magendie and Claude Bernard. So what did they do? They conducted the experiments on animals and they checked the efficiency of the drugs which could later be used on human beings. The last century has seen a rapid growth of the subject, with several new drugs, new concepts and techniques being introduced. We now know much more about receptors and molecular mechanisms of action of many drugs. Several diseases which were considered incurable and fatal can now be completely cured with just a few tablets. So with different technologies in the pharmacology, there is more advancement of the drugs and its efficacy, and many diseases which were considered incurable and fatal can now completely be cured. Let us look at some important definitions. What is a drug? Drug. A drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefit of the recipient. This is the WHO definition of a drug. Next we see pharmacodynamics. It is the study of the effects of the drugs on the body and their mechanism of action, that is, what the drug does to the body. The next definition is pharmacokinetics. It is the study of the absorption, distribution, metabolism and excretion of the drugs, that is, what the body does to the drug. Next, therapeutics. It deals with the use of drugs in the prevention and treatment of disease. Next, pharmacoeconomics. It deals with the cost of the drugs used therapeutically. Next definition is pharmacogenomics. Genomics refers to genetics, okay? So it deals with the use of genetic information in selecting drugs for a person. Say suppose a person is suffering from a particular genetic disorder, so which kind of drug is suitable for him or which drugs could be harmful for him can be studied under pharmacogenomics. Next, pharmacoepidemiology. You know the term epidemiology relates to population. So it is the study of both useful and harmful effects of drugs on large number of people. This could include a particular city or a particular country or even the entire world. Next, pharmacovigilance. It deals with the epidemiological study of adverse drug effects. So what do you mean by adverse drug effects? Say for example, if you take a medicine for stomach pain and then suddenly you feel nauseated, you feel loose motions. So those are adverse drug effects. Next, toxicology. It deals with the adverse effects of drugs and also the study of poisons. So what are some of the drugs which are very harmful for the person that it becomes or reaches the toxic levels which could ultimately even lead to the death of the person? That is the study of toxicology. Chemotherapy. It is the use of chemicals for the treatment of infections. The term now includes the use of chemical compounds to treat malignancies. So here malignancies means tumors which are spreading all over the body. So to treat that we use some chemical compounds. It could be in the form of tablets or injection forms, and that is known as chemotherapy. Next we see pharmacopoeia. What is pharmacopoeia? It is the official publication containing list of drugs and medicinal preparations approved for use, their formulae and other information needed to prepare a drug, their physical properties, tests for their identity, purity and potency. Thus, we have the Indian Pharmacopoeia. The list is revised at regular periods to delete obsolete drugs and introduce new ones. So here what we mean by obsolete drugs are the drugs which we are no longer using, or because of their harmful effects those drugs should not be used. And what are the new drugs which can be used? Those are included in pharmacopoeia. So what it is an official publication containing the list of all the drugs and medical preparations approved for the use. Next, pharmacy. It is the science of identification, compounding and dispensing of drugs. It also includes collection, isolation, purification, synthesis and standardization of medicinal substances. Next we move on to sources of drugs. The sources of drugs can be natural or synthetic. What are the natural sources? One, we can receive from plants. Example of those drugs are atropine, morphine, quinine and digoxin. Please remember these names, it is very important question. Next, animals. Example: insulin, heparin, gonadotrophins and antitoxic sera. Then minerals, example: magnesium sulfate, iron, sulfur and radioactive isotopes. Microorganisms, example: penicillin, cephalosporins, tetracyclines and other antibiotics. And from human beings, the examples are immunoglobulins from blood, growth hormone from anterior pituitary and chorionic gonadotrophins from the urine of pregnant women. Next, moving on to the synthetic drugs, the examples are quinolones, omeprazole, neostigmine, sulfonamides. The various methods through which we can use are cell culture, example urokinase from human kidney cells, recombinant DNA technology, example human insulin and erythropoietin, and hybridoma technique, example monoclonal antibodies. So with this we come to the end of the introduction part. The important questions which can be asked from this topic are: discuss the history of drugs for 5 marks, sources of drugs for 5 marks, and important definitions like define drug, pharmacodynamics and pharmacokinetics, which will be asked for 3 marks in total. Please subscribe, like and share and comment how you feel the video was, and we will surely improve and help you out with this. Thank you.